Hi everyone, in today's video I'm going to talk about colic in infants. Colic is a word used to describe the moments when your otherwise healthy child or baby cries excessively and cannot be soothed. This is a type of crying where your child is not consolable after you've made sure everything is okay, including changing their diapers and feeding them well. And this may drive you as a parent into tears because it can be so frustrating. It is exhausting to the mother as it occurs even when you're trying to rest or sleep. All children cry, but to objectively describe this crying, we use the number 3. That is, it occurs when your baby is below 3 months or thereabouts. Your baby may cry for more than 3 hours in a day, and these episodes occur on more than 3 days in a week. Your baby may appear flushed when he or she is crying, and your baby's tummy will be rumbly, or he or she may have wind. Your baby may also appear to be pulling their legs, arching their back, and clenching their fists as they cry. Yes, it is important to seek a professional medical opinion to make sure that there is no other cause for the crying. So when you visit the doctor, you'll be asked to elaborate more about the moments, durations, and timings when your baby cries. You can carry a diary with you if you feel you may not be able to remember the details. And you may as well take a video of your child during the episodes to allow the doctor to observe the exact behavior and make a more informed diagnosis. It's also good to have a record of your child's feeds and timing. So the doctor will do a full examination of the baby, and it's good to carry a changing bag as you'll be required to completely undress the baby. Be ready also to demonstrate how you breastfeed your baby and receive guidance on how you can improve the technique. Be ready as well to demonstrate how you burp your baby and receive advice on various methods. A colicky baby is usually a healthy baby. If your doctor picks up anything they would like to confirm from your history and the examination, they may send you to the laboratory for some tests or refer you to a specialist who is a neonatologist. So you should get worried and urgently take your baby who is less than 3 months old to the hospital when you realize that your baby has a weak and high-pitched or abnormal sounding while they cry, or when your baby gets floppy when you pick them up, if your child refuses to breastfeed, when your child has a breathing problem, the child develops a fever, if your child looks pale, if you happen to see blood in the child's stool, and if your child has fewer wet nippers than usual. It's also good to be concerned if your child's umbilical cord starts oozing or bleeding. So many parents would ask, what causes my baby to cry so much? Up to date, experts do not really know what causes colic in some babies and not others. And in this case, you may find yourself reading conflicting information or getting conflicting ideas from different sources, which might confuse you as a parent. So it's always good to consult your pediatrician before you take any remedies. Some research suggests that this is part of a child's development of the digestive system that makes wind or gas an issue, but this research is still ongoing. So the cause of colic in babies is not really known. So how would you be able to soothe your baby when they are having colics? So once your pediatrician has confirmed that all is well with your baby, there are a few methods that mothers have found to soothe colicky babies, and these may or may not work for your child and may work on some days and not others. And these include establishing a pattern of feeding and settling in response to your child, avoiding excessive stimulation such as noise, light, and handling, calming your baby with skin-to-skin contact when you sense they are about to cry, massaging your baby's tummy to help the wind and stool. You can also try a warm bath. Burp your child correctly after every feed, especially at night, and be patient with time. And try rocking your baby gently. Sing to your baby or play any white noise that he or she may like. Use the correct technique to breastfeed your baby that ensure he or she doesn't swallow so much air. This may be taught to you at our baby clinic or by a lactation consultant. Colic is not harmful to the baby, and infants with colic are well thriving, though colic is more distressing to the carers, that is the mother, the father, or the nanny, than to the child. Always remember it will pass in a few weeks. So how to cope as a mother? It's good to take your child to a paediatrician for confirmation and reassurance that nothing else is causing your child to cry, because this information will relieve you a great deal. So make sure you carry out your part by responsive feeding, as I mentioned earlier, using the correct technique to breastfeed your baby at all times and burp your child properly. Remind yourself that your baby's crying is not your fault and he or she won't hurt him or herself. It does not in any way reflect on your parenting skills. Remind yourself that it will pass. Just give it time. Place your baby safely in a cot or Moses basket and give yourself timed 5 minutes as time out. Practice deep breathing, and if you have a helper with you available, like your mother-in-law or the father of the baby, take turns to soothe the baby. If you are alone, try the suggested techniques that I have mentioned earlier. And when your baby is sleeping and calm, rest as a mother as well. This should include the daytime, and politely explain to the visitors that you may have the issue. A majority of considerable relatives and friends and previous mothers will understand. Enjoy the good times you have with your baby and remember them during your time out. And if you're still struggling with colic, you can seek further support from a counselor. So experts confirm that colic mixtures are not proven benefit. They are rarely indicated. Weaning from breast milk has no benefit. It's good to maintain the 6 months exclusive breastfeeding schedule as recommended. Formula changes are usually not helpful unless there is proven cow's milk allergy or lactose intolerance for those already on formula. So this brings me to the end of this video. Thank you for watching. Hope this information was informative. Wish all parents the best as they bring up their children. See you in the next one.